What are the assessment tools for prodromal schizophrenia? Imagine catching a storm before it hits. That's kind of what assessing the prodromal phase of schizophrenia is like. It's about spotting early signs before full-blown psychosis develops. During this phase, people might show subtle changes like social withdrawal, unusual thoughts, or mild perceptual disturbances. To identify these early warning signs, clinicians use specific tools designed to catch these symptoms early on. One of the main methods involves structured clinical interviews. The structured interview for prodromal syndromes, or SIPs, is considered a gold standard. It's a detailed interview that asks about symptoms like unusual thoughts, perceptual changes, or social withdrawal. It takes about an hour and a half to complete and requires trained professionals. Because of its depth, it's very accurate but not always practical for quick screenings. Another similar tool is the Comprehensive Assessment of at-Risk Mental States, or CARMS. It also involves a detailed interview that helps identify people at high risk of developing psychosis. Like the SIPs, it looks at symptoms, functioning, and thought patterns. It's used mainly in specialized clinics and takes around an hour to administer. Both of these tools are great for confirming if someone is in the prodromal stage, but they need trained clinicians and are more suited for mental health specialists. For quicker screening, self-report questionnaires are often used. The Prodromal Questionnaire Brief, or PQB, is one of the most popular. It's a short survey with around 20 questions that people can fill out on their own. It asks about experiences like suspicious thoughts or perceptual disturbances. If someone endorses 3 or more symptoms, it suggests they might be at risk. The PQB has high sensitivity, meaning it's good at catching those who might be at risk, but it's not perfect at ruling out those who aren't. Another brief tool is the Prodromal Questionnaire 16, or PQ16. It's a shorter version with just 16 questions. It's quick to complete and has been tested in many languages, making it useful in diverse settings. It's especially helpful in primary care or community clinics where time is limited. There are also other screening tools like the PRIME Screen Revised and the Youth Psychosis at-Risk Questionnaire Brief. These are less common but can be useful in specific research or clinical settings. They help identify early signs but might requiring special permissions or training to use. In addition to questionnaires, clinicians use specific criteria to define high-risk groups. These include attenuated positive symptoms, brief psychotic episodes, or noticeable decline in functioning. When someone meets these criteria, they are considered at ultra-high risk for developing schizophrenia. Overall, the process involves a two-step approach. First, a quick screening with tools like the PQB or PQ16 helps identify who might need further assessment. Then, trained clinicians conduct detailed interviews like the SIPs or CARMS to confirm the risk. This method helps catch early signs efficiently and can lead to early intervention, which is key to better outcomes. In primary care, these questionnaires are especially helpful because they are easy to use and don't require special training. They can be administered during routine visits, making early detection more accessible. Telemedicine is also opening doors for remote assessments, especially in areas with limited mental health services. By using these tools, healthcare providers can identify at-risk individuals sooner and help them get the support they need before the condition worsens.